On the outside, bones look solid and rock-like, but they're not. They're living tissue. There's a smooth, hard outside layer made out of cortical bone, and the inside is a strong, lightweight, honeycomb-like structure called trabecular bone, which contains blood vessels and bone marrow. The combination of cortical and trabecular bone enables the skeleton to be light, strong, flexible, and efficient. By about age 20, our bones have grown to their full adult size and density. But activity in our bones is far from over. Our bodies are constantly remodeling our bones to meet the demands we put on them. Remodeling helps keep bones young and healthy by replacing old or weakened areas with new, well-formed tissue. In a cycle that takes about 3 to 4 months, destroyer cells called osteoclasts break down old bone, so that the building cells, the osteoblasts, can replace it with new bone. Adults have about 10 to 15% of their bone replaced each year. As we age, osteoclasts are sometimes more efficient at removing bone than the osteoblasts are at rebuilding bone. This imbalance over time lends to bone loss. Some bone density loss occurs in both men and women as part of the normal process of aging. But osteoporosis causes abnormal, severe bone loss. In bones with osteoporosis, the outside hard cortical layer gets thinner, and the honeycomb trabecular inside becomes more porous. Bone is broken down and little or nothing takes its place. Fractures occur most often at the spine, the hip, and at the wrist. People with advanced osteoporosis may get multiple compression fractures of the spine, causing the spine to curve and bend forward. This is called kyphosis. Some people are more at risk than others. Let's take a look at some of the risk factors for osteoporosis. Being a woman, especially Caucasian or Asian, thin or small frame, family history of osteoporosis, low estrogen levels due to menopause or surgery, particularly early menopause, amenorrhea, interruption of menstrual cycle, common in dancers, athletes, and women with eating disorders like anorexia nervosa, men with low testosterone levels, being 65 plus, a diet low in calcium, use of corticosteroid medications, sedentary lifestyle, cigarette smoking, excess alcohol or caffeine. It's important to get enough calcium in your diet. Here are some daily recommendations. You can still frame the video and write down the information that applies to you. And here are some sources of calcium. You also need vitamin D to help your body absorb calcium. Here are some daily recommendations. And some sources of vitamin D. There's a lot you can do to stem the tide of osteoporosis. If you have risk factors, you may benefit from a bone density test. Tests like DEXA dual energy X-ray absorptiometry can measure density at risk sites and can detect osteoporosis before a fracture occurs and predict your chances of fracturing in the future. The test is completely painless and takes only a few minutes. If you find you have osteoporosis, or if you're greatly at risk, you'll need medical treatment. You and your doctor will have a number of options. Generally, a combination of medication, a calcium and vitamin D-rich diet, and bone-loading exercise are prescribed. But each person is different, and it's impossible to determine a course of prevention and treatment just by reading research or watching a video. Consult with your doctor, get all the information you can, and together you can decide what's best for you. And remember, As Dusty always says, it's never too early or too late to start taking care of your bones.